So I would be speaking on the therapeutic profile of human umbilical cord blood serum in allergic eye diseases. It was a pilot study which was conducted at AIIMS Bhopal. We don't have any financial disclosures to make. What we know about is that ocular allergies are because of hypersensitivity reaction and exposure to specific antigens. Particularly, the mechanisms involved are prostaglandins and leukotrienes mediated. So the treatment modalities are antihistamines, mast cell stabilizers, steroids, NSAIDs, and in severe cases, immunomodulators or cyclosporin or tacrolimus may be given. What was not known till now was that the research question in this study was that whether any other treatment modality which is responsible for causing ocular surface restoration would be helpful in treating patients of ocular allergies. So we thought that the umbilical cord blood serum could be helpful in such cases because it has got high concentration of growth factors, the EGF, TGF beta and substance P. It helps in proliferation, differentiation and also maturation of epithelial, ocular surface epithelium, and has got a very strong anti-inflammatory action. So with this objective of the study was to evaluate the efficacy of UCBS in ocular surface restoration, whether there is any improvement in visual functions based on the objective and subjective parameters, and what was the overall best predictor of clinical improvement in patient which was treated with UCBS. The sample size calculation was done based on this study with the effect size of 0.25 and the power considering to be 80%. The sample size was found out to be 23. We did a detailed ophthalmic examination and grading of all ocular allergies were done. Patients were treated, classified into severity grades, and all the such patients were included. The exclusion criteria comprised mainly of any infection or posterior segment anomalies. It was a prospective randomized clinical study in which total 40 eyes were evaluated for a follow-up of minimum of 3 months. The cases were randomized into 2 groups. The group 1 was UCBS and group 2 was autologous serum. The randomization and blinding was done into 2 blocks, as I said, and patients were evaluated by single blinded observer with appropriate statistical indices. We harvested UCBS through uncomplicated cesarean deliveries after the triple H test. The primary outcome measure was improvement in the severity grade and the eye sensation score. Secondary outcome was whether the resolution of the intermittence or the persistence of symptoms was there, and also the improvement in visual acuity. The demographic pattern was the most common age group was up to 19 years. Most of the cases were bilateral and there was slight male preponderance. We graded, we made the 2 groups homogeneous in terms of both symptoms and severity grade. So this homogeneity would not be, by getting this homogeneity, we excluded any confounders in both the groups. Coming on to the results, we found that response to treatment at 1 and 3 months in UCBS and AS, that is group 1 and 2, was significantly better in UCBS as compared to the AS group. That means at 1 month and at 3 months, almost all patients resolved with UCBS, whereas just 60% in group 2. However, in severe grades of ocular allergy, there was a difference, but it was not statistically significant. The subjective improvement was measured with the ARIA classification, and we found that the subjective improvement with reference to itching, redness, disabling visual symptoms which is impairing with the school or official work, we saw again that at 1 month and at 3 months it was significantly better in UCBS as compared to AS, respectively of 100 and 60%. Eye sensation score at 3 months again was seen in comparison to pre-treatment level. We can see here that the eye sensation score to begin with was present just in 12 patients in mild and moderate variety, whereas after completion of the therapy at the 3 months, almost all patients had eye sensation score reduced to 1. Whereas in group 2, it was just 16 and 4 patients in moderate and severe variety. The statistical significance was seen for all objective and subjective parameters, and we found that the statistical significance was seen in eye sensation score in mild ocular allergies and moderate ocular allergies. It was not significant in visual acuity and in severe disorders. The overall best predictor of improvement was the eye sensation score and response to severity grade. There have been many studies which have been conducted on UCBS on various disorders like dry eye disease, on persistent epithelial defect, on neurotropic keratitis, and all have reported that it has got a good impact on the ocular surface disorder. These are some clinical pictures of improvement seen in the group 1. And the conclusion that this study pioneers in showing the efficacy of UCBS, mild OA respond well as mild and moderate respond well as compared to the severe varieties, and it can be considered as an alternative where you want to give for long-term steroids, and it helps in ocular surface restoration, both objective and subjective parameters. The overall best predictor of improvement was eye sensation score and response to severity. Thank you very much. These were my references.